Hi, I'm Dr. Paul Paddle, ear, nose and throat surgeon at the Melbourne ENT Group. In this video, I'm going to talk about the post-operative journey and care instructions after various types of major ear surgery we perform. If you're watching this video, you're thinking about having or about to have major ear surgery. Examples of major ear surgery include surgery to repair a hole in the eardrum, a myringoplasty, surgery to remove benign diseases of the middle ear, such as a mastoidectomy or tympanoplasty, and also reconstruct the hearing mechanism, and so on. Basically, any ear surgery more involved than the placement of grommets. After the surgery, you will generally go home the same or the following day. You will receive prescribed analgesics on discharge, such as paracetamol or ibuprofen. Use these as directed and consult your ENT surgeon if you have any concerns or questions. Most patients do not experience too much pain, but if pain occurs, it can be relieved with these simple medications. Your ENT specialist may prescribe topical antibiotic drops after your operation. Often they are commenced after the first post-operative visit. Use these as directed and check out our separate video on how to use these ear drops if you need further tips on applying them. You must keep your ear canal dry until further advice from your MEG ENT specialist. After your specialist removes any packing, you'll be able to use cotton wool coated with Vaseline or earplugs or blue tack, shower caps and so on when showering or taking baths to avoid getting water in the ears. Avoid swimming until your MEG ENT specialist advises you it is safe to do so. If you are able to return to swimming, using earplugs, custom or disposable, is advisable. Earplugs can be bought from chemists and are of variable effectiveness. Ensure they are the ones for water exclusion, not the noise protection variety. The best are custom-made plugs, well they are more expensive. They are available from audiologists and hearing aid specialists. Wash your hair carefully to sink and keep your operated ear away from the water. You may then wash the rest of your body as usual. With respect to general ear canal care, do not remove your ear packing. If your ear packing does fall out, don't try and put it back in. Please notify the MEG practice as soon as possible. If instructed to use antibiotic drops, drop them on top of the ear packing, as this is usually a sponge material as instructed. In terms of skin wound care, you may have a wound at the opening of the ear canal or behind the ear. This wound may be covered by adhesive paper strips. Please clean this area daily just with water and a simple medicated antibacterial soap if instructed. Gently dab this region dry and leave it exposed. These little band-aid strips may fall off as the days go by. If not, your MEG ENT specialist will remove them at your post-op appointment. Bleeding from the ear from the wound behind the ear occurs occasionally. This is common after any pack or head dressing is removed, but usually stops very quickly. If bleeding occurs, place gauze or cotton wool over the area, and if it continues to be a problem, contact your MEG ENT specialist or GP. With respect to diet, there are no restrictions. With respect to return to normal activities, in the first 72 hours, have relative rest at home. Try to sleep on your back with your head elevated by 2 to 3 pillows. In the weeks 1 to 2 after the operation, avoid blowing your nose. If required, use saline sprays to clean your nasal passages. Avoid lifting heavy objects. Avoid bending over. And if you need to pick up objects from the floor, do so by bending your knees and keeping your head upright if possible. In the weeks 3 to 4 after the operation, you may now restart slowly all previous levels of physical activity. In the first 3 months after your operation, your MEG ENT specialist will generally advise you avoid taking air flights during this period if possible. Do this if you have a headache or fever or severe pain that doesn't respond to the prescribed analgesics. Your MEG ENT specialist will be keen to provide advice to your doctor if required. Visit your emergency department or call 000 if you have sudden onset hearing loss or dizziness or increased nausea or vomiting. Ask the attending physician to contact your MEG ENT specialist for immediate advice. On your first post-operative visit, your MEG ENT specialist will inspect your wounds to ensure there is no infection or collection of fluid. They will also remove any skin dressings around the ear. On your second post-op visit, your MEG ENT specialist will remove the packing from your ear and clean your ear canal. A follow-up audiogram will be organised through your ENT specialist, or you'll be instructed to attend for a post-operative audiogram in your local area. Thanks for watching. For more videos on ENT conditions and treatments, instructions and procedures, check out the rest of the videos on this channel, or head over to our website for more details and for downloadable instruction sheets.